Now, we've got some better news today, but there's some rather poor news to start off with, and that's the increasing cases in these countries that I want to talk a little bit about today. So Brazil, definitely increasing death rate, daily death rate. India, definitely increasing trend. Mexico and Pakistan, despite Pakistan having a lower population. So we can see that the death rate and the case numbers, as we know, the case numbers are increasing in those countries as well. So welcome to this global update. It's still June 2020. Now, Margaret from Queensland has come up with a remarkably good idea, and it's don't talk on trains. So when we're in public places, we don't want to be talking to each other, which sounds rather miserable. But the point is, if I'm breathing quietly, I'll be expelling less of these water droplets and this aerosolization of water, which of course contains the viruses inside. So if I'm talking 2 meters away from you, and I have a vigorous conversation, I'm talking to you like this, then the droplets can reach you. And if I'm talking even just a metre away in a reasonable voice, then again the droplets are going to reach you. Whereas if I'm just breathing quietly, especially through a mask, then that's going to greatly reduce the aerosolization and therefore reduce the transmission of the virus, which of course is exactly what we want. So very simple idea, but very good one. So don't talk to each other on public transport for the time being. Now, Brazil, to come on to one of those cases. Second country to have over 1 million cases, unfortunately. Deaths are increasing. But we know these are massively underreported. Now, the World Health Organization have said the testing needs to be at least 20 times what it is. So Brazil is massively under-testing. And we know from documentary evidence that I've seen from news outlets that the deaths in Brazil are greatly underreported. So people are dying without it being recorded, especially in rural areas, in poorer areas. And deaths that are almost certainly caused by COVID-19 are being attributed to other causes such as pneumonia. So the situation in Brazil is even worse than these official figures are indicating. Way under testing. Need a lot more testing in Brazil. Now, the President Bolsonaro, mass protests against him and mass protests for and against his policies. So basically, we've got a lot of political unrest in Brazil at the moment, which is unfortunate. Now, 2 health ministers, both of whom seem fairly competent. They were both doctors. One's been sacked by Bolsonaro and the other's resigned. He found the situation intolerable. So quite who's in charge of the health situation in Brazil at the moment is unclear, but it's not an ideal situation to have such political unrest when there's such urgent demand, as illustrated quite clearly by this graph with the death rate here. So well over 1,000 deaths per day in Brazil. Really is a time for coordinated action, and unfortunately we're just not getting that at the moment. So St. Paul, 12,500 deaths. Rio de Janeiro, 8,800 deaths. These are the 2 epicenters, São Paulo and Rio. As well as the spread to the more deprived neighbourhoods. There's a lot of slum areas in Brazil, of course. A lot of very poor people in Brazil. Very close dwelling accommodation. People living cheek by jowl with each other. And remote areas. And another thing that's concerning is the death rate in indigenous people in Brazil seems to be double what it is in the rest of the population. And this is a disturbing trend from around the world. There seems to be similar trends in the United States and probably in some parts of Canada as well. And South America-wise, Mexico, Peru, Chile, Argentina, all greatly increasing. So the Americas, I'm afraid, is the current sort of next, well, it's the epicenter at the moment. There's more cases now there than anywhere else. So, that's not ideal. Now, moving on to the United States. 2.2, that's 2. What should that be? That should be, anyway, it's 2.2 million cases. I think I've got an extra figure in there somewhere. So 2.2 million cases. Deaths, of course, are increasing. Over 120,000 deaths now in the United States. Now, this is a collaboration between a COVID tracking project and the Antiracist Research and Policy Centre in the United States. And this is their site here, so do go on that and have a browse around. There's lots of interesting stuff on there. For example, this site breaks down the state by state, the degree to which states are recording sickness and death and recording ethnicity with that. Other states just don't seem to do that. Some states, there's only about a 50-60% recording of ethnicity and deaths. Other states, it's much higher. It's nearly 100% in some states, but it varies quite a bit. So what this group have ascertained so far is we've lost at least 25,176 black lives lost. So this is an awful lot of death. Of these, over 25,000 black lives have been lost. Now, 13% of the population is African American, and they've suffered 23% of the deaths where race is known. So, given that the racial profiling is underreported, we would expect the real number to be higher than this, unfortunately. Because the proportion that we don't know about, the numbers of deaths that we don't know about, we would expect this ratio where there's more black Americans than white Americans dying to be maintained. So even though it's only 13% of the population, it's at least 23% of the deaths. So black people are dying at a rate of more than 1.5 times higher than their population share. Now, this is an awful lot of black lives. Now, we know that vitamin D levels are lower in African Americans than in white Americans. And yet we see no protests about this. We see virtually nothing in the media about it. We see no one jumping up and down or protesting about this, despite the fact 25,000 lives have been lost. It seems very anomalous to me. Why are people not saying, just a minute, health authorities, get the levels of vitamin D checked in all the black people in America, and then we can correct it if it's low and get rid of that variable? Why is this not being done? I'm just bemused by this. And if it turns out that my thinking is completely wrong and the thinking of many scientists around the world is completely wrong, then by increasing vitamin D levels, we've lost nothing, because lack of vitamin D is associated with other diseases as well, such as heart disease and other conditions. So why is there this complete blind spot in the United States? If they're in the United States, for goodness sake, write to your senator or whoever you write to in the United States and say, let's get vitamin D tested so it can be corrected, because too many African Americans are dying. It's an absolute tragedy. Now, Washington State, some hospitals are overwhelmed. This simply means that people who should be surviving will probably die. Florida, over 1,000 new cases per day for the last 2 weeks now. And one of the mayors in Florida is saying that there may need to be some shutdown of the whole state potentially again if cases continue rising as they are at the moment. Now, New York City, the situation is somewhat better. The cases are continuing to drop, but there is reopening. Now, the reopening will cause a resurgence of cases, but of course with a delay, because there's always a delay in these things. So there are going to be more cases. Herd immunity is not yet enjoyed, despite the fact that New York has suffered substantially already. Unfortunately, more cases to come there, I fear, as this reopening continues. Now, South Korea. I must apologise about South Korea. I've got it wrong. I've just got South Korea wrong. A couple of weeks ago, at least 2 or 3 times, I said, look, there's clusters of cases in South Korea, but don't worry about it. The South Korean authorities will be on top of this and they will isolate it, as they've done in the past, as they did very effectively in the first wave. But the government in South Korea is saying they're now battling a second wave. I thought they would contain these cases. It turns out, it looks like I was wrong, especially around Seoul, where there's a lot of cases. And Seoul is due to reimpose stronger measures if the new daily cases remain above 30 a day, which they are at the moment, just in the Seoul area. And this surprises me. Apparently, the news reports are saying there's complacency of citizens on physical distancing. Having demonstrated such excellent self-discipline in the early parts of the first wave, it now seems that the people in Korea are being less vigilant. Maybe they've got tired of it, but the virus hasn't got tired. The virus is still there. This is the problem. Increasing public transport usage as people go back to work, of course, is another issue, because we know that public transport is a very confined space, and therefore the possibility for viral spread is greater, despite the fact that people in Korea are wearing masks universally in public transport. But there's still more cases coming. Now, the Korean Centre for Disease Control, so just like there's a Centre for Disease Control in the States, there's one in Korea as well. This is the Korean version, the Centre for Disease Control. And it's saying country could see as many as 800 new cases a day by mid-July. So it looks like the Korean authorities are actually anticipating a second wave. And the R value is 1.8. So I got it complete. I really thought they would contain this. I've got it wrong. And this means that every one person on average is infecting 1.8 other people, which means we're going to get accelerated growth, driven by small but persistent outbreaks stemming from a holiday in May, according to the Korean Centre for Disease Control. So it looks like the Koreans let their guard down a bit much and the second wave is coming. Now, I had thought, well, indeed, the Korean Centre for Disease Control had thought, and I was thinking this as well, that there would be a second wave, but later on in the year, as I expect a second wave to occur in my country in autumn. So the Korea Centre for Disease Control is saying we originally predicted that the second wave would emerge in fall or winter, autumn or winter, but our forecasting turned out to be wrong. So, the Korean Centre for Disease Control are putting their hands up and saying, look, we got this wrong. The second wave is coming now in Korea. Very, very disappointing. I was wrong. The Korean Centre for Disease Control were wrong. Surprising, but this is what the data is showing. And the Korean Centre for Disease Control saying, as long as people have close contact with others, we believe that infection will continue. So there's a message here for all countries that we need to maintain the social distancing. Now, just on that point, I think what I'll do is I've just got a video from my local supermarket. This is just my local Sainsbury's a couple of days ago. Very good social distancing on the queue to get into the shop. Ordered, well disciplined, good tempered, but very good social distancing. Outside as well, so the possibility of spread here is virtually nil, unless people are running their hands on these rails, which wouldn't be good, but they're not. I mean, it was fine actually. You only had to wait about 10 minutes to get into the shop, so it wasn't bad at all. So that was a good example of the social distancing there, because the Korean authorities were saying, as long as people have close contact with each other, we believe that infections will continue. And of course, inside, especially in public transport, the risk is all the greater. Now, moving on to the UK now. So the real number in the UK now is probably 10 times that, maybe about 3 million. Now, the deaths, of course, this number continues to increase. There's nothing we can do about that. But the rate of increase has massively declined in the UK. This is the lowest number of new cases in the UK since March. So that is encouraging. I mean, it's still 15 deaths. It's not good, but it's going down significantly. The new cases, according to the COVID symptom tracker app that I fill in every day, and I hope you do too, is 3,612 new cases per day this week. That's what the app is showing. That's the King's College app with Professor Tim Spector. 25% down on last week. So the new cases per day this week are 25% less than last week. So that's good news. And that gives us an R0 of 0.8 in the UK at the moment. In other words, as you now know, every infected person only infects 0.8 of a new person. on average, and therefore the number of infected people will progressively drop, as we see here, where that is 25% lower than last week. Now, 4th of July, it looks like there's going to be an announcement on Tuesday that pubs are going to reopen, albeit with social distancing, on the 4th of July. Now, quite why our Prime Minister has chosen the 4th of July for resumption of eating out and going to the pub day, I don't know. I guess it's our kind of Independence Day. And I think this is based on the Independence Day in the United States, where the United States liberated themselves from some colonial power. Not quite sure which one it was. Now, other than good news from the UK, saliva antigen test. This is interesting. So this new test is testing for the antigen, that's the viral particles in the saliva. Now, the existing tests, the antigen test, it's a nasopharyngeal or an oropharyngeal swab. So it does take a degree of skill to do that. The swab's got to go quite far back. It's an unpleasant test. But this one is just spitting saliva into a pot. Then it will go into a machine, and that will look for the fragments of the ribonucleic acid, which is the genetic material of the virus. They're calling it the Optigen test to make us think it's optimum. But if it does work, it will be indeed. And it's being trialled at the moment on 14,000 primary care staff, quite a few other essential workers, and also staff and students from Southampton University, a 4-week trial. And the advantage of this is it could identify people that are asymptomatic, so that's going to stop them going out to work. And so before someone goes to work, they could test themselves. If they have the virus, that means they're potentially infectious, and they can just isolate themselves for 14 days. So it'd be very good for identifying asymptomatics, who of course can transmit the disease to people that could suffer badly or die. And it's hoped that the results could be in less than an hour once this test is well established. And that would indicate self-isolation for 14 days. So quite encouraging that. There's another encouraging thing. It's developing in Israel and Kenya, which is just testing the breath. Presumably we're also working on RNA fragments from the COVID-19 virus. So if that works out, that could be actually a major step forward. We will get cheap, easy, readily available, fast antigen testing. Just a case of how quickly it comes in. Now, Pakistan, another country that's concerning. How accurate this is, it's certainly not less than these figures. The World Health Organization said they need more testing, but for the population of Pakistan, I would have thought they would need even more than that. But anyway, they're not testing enough is the moral of the story there. Now, Pakistan's doing what they call a smart lockdown. So basically, they can't afford to lock down whole cities because of the economic impact of that, and people were going hungry. So what they're doing, they're locking down a particular area. So if a particular area becomes infected, they'll lock that down while other areas can carry on with economic activity depending on the need at the time. So it's this moving around so-called smart lockdown. Let's hope it works as they try to isolate the infection hotspots. Now, Rawalpindi, apparently there's been problems there because there's not enough police to enforce the lockdowns in hotspots. So this means that if these lockdowns aren't enforced, the people will go out to work, try and make money and try and get food, which of course is understandable. But it also means that the virus is going to spread. So that's one of the reasons I'm pessimistic, because it needs the lockdown in Pakistan seems to need enforcement. And if you haven't got public will, you've got problems. And apparently hospitals are turning away patients already as Pakistan continues to lift restrictions. Now notice that line there we mentioned, hospitals are turning patients away. We know that about 4 or 5% of people that get this disease are going to be critically ill. If they get good medical treatment, they could survive. If the hospital's turning them away, they're probably going to die. This has massive import. This could mean that the death rate, instead of being about 0.5%, could be as much as 5% if medical care is widely not available at a time that many people are getting the illness. So if hospitals are turning patients away, that was an Al Jazeera news report saying that. That means that the case fatality rate is going to rise. India also concerning, even by official figures, cases and deaths increasing. Infections apparently are soaring in rural areas. Now, what's happened here in India, and again, there's been a long delay, much longer than we would have expected, much longer than I expected. But what you have in India is you get a lot of migrant labourers. So they go from rural areas. I mean, in the past, India used to live in its villages. Urbanisation is a relatively new feature in India. But of course, there are mega cities there now, metro cities. So people working in the large cities, they lost their employment because of the COVID-19 lockdown. They were daily wage earners. That means they didn't make any money. That meant they could potentially not eat that day. They were dependent on food handouts. So what this huge population of migrant labourers are doing is they're moving from the cities where there's a lot of infection out into the countryside, into the home villages so they can eat. But of course they're taking the virus from the cities with them. So the virus is spreading now all over the rural areas as the migrant workers return home carrying the virus with them. And in the rural areas in India, healthcare facilities are often very much lacking. Very poor healthcare facilities in many areas, and for poor people, the healthcare is not that. For poor people, the healthcare is not that good in the cities anyway. So again, a situation where people will be dying through lack of basic healthcare, unfortunately, thereby increasing the case fatality rate. And 98 of the 112 of the country's poorest districts now have active spread. Iran, also a problem. Again, the reporting from Iran is not good. Now, I've just read an interesting paper about high prevalence of vitamin deficiency in the Iranian population. And vitamin deficiency is defined as less than 50 nanomoles per litre. And that's actually not that high. That's just 20 nanograms per mil. So I would actually say that's lower than you would want, much lower than you would want. But nevertheless, even taking that relatively low value for deficiency, a meta-analysis of 18,000 subjects has found that 45% of men, 62% of women, and 60% of pregnant women who particularly need vitamin D are deficient. That means they're less than 20 nanograms per mil or less than 50 nanomoles per litre. So they really are quite deficient. And in my view, that will significantly reduce the quality of their immune responses. Having said that, the level of deficiency varies quite a lot between various geographical regions in Iran. But it's still obviously a common problem, the vitamin D deficiency in Iran, as evidenced by a number of 18,000 cases, which is a good sized study. So that data is likely to be highly valid data. Now, Germany, of course, did very well. But now, in Germany at the moment, the R0 is 2.88. Now, I was amazed when I heard this. This seems a remarkably high transmission rate. And of course, what this means is that on average, each infected person is infecting nearly 3 new people. So it sounds appalling. But what you have to remember is, in Germany, the number of people that are infected is actually relatively small. So there's been a particular outbreak, and we'll see how many, 1,300 workers have been infected. So because the number of cases is relatively small and there's now been a big growth in the number of cases, that gives a high R0 without transposing into very, very large numbers. So this is not transposing into numbers of thousands or tens of thousands as that number would indicate, because it's from a relatively small initial sample size. So from a few hundred being infected, each one of those has affected 2.88. That's the way that's worked out. Nevertheless, it is a high R value. Robert Koch Institute for Infectious Diseases has said that on Saturday, the R0 was between 1.79 and 2.88. And the 7-day rolling average is 2.03. So let's just say it's been a bad week in Germany because the number of cases has doubled in the past week. But it's mainly due to local outbreaks in the state of North Rhine-Westphalia. Basia, not sure. Anyway, it's where Cologne is, the famous city of Cologne with its twin-spired cathedral. And it's at a meat processing plant. The workers became infected. Now, are case numbers increasing outside of these localised outbreak contexts? Is unclear at the moment. Now, I would be fairly confident the German authorities can contain an outbreak of this size. Although, having said that, I was wrong about Korea, wasn't I? But I really do think the Germans can contain this. So I think this R0 value in Germany will be going down again soon, although it will be maintained because the Germans are opening things up quite a bit now. So is this just due to this localised outbreak, or is it something more general? Too early to tell. The next few days will show that in Germany. Now, abattoir meat processing. This rings a bell, doesn't it? Because we looked at this in the United States, where there was numerous outbreaks in meat packing plants in the United States. Now, we did look at the reasons for this then. This is in the United States. Many workers are black or brown. And likewise in Germany, a lot of people working in abattoirs are outside workers. So that could be a factor. In the States, Somalis tend to gravitate to this type of work. I don't know if that's the case in Germany or not, but it could well be. In the States, chemicals are used for processing meat that may affect respiratory health. Again, in Germany, it would surprise me if that's the case, but I don't actually know. But crowded conditions, people work elbow to elbow on these conveyor belt production lines. So close crowding, poor ventilation, lack of natural light, limited access to hygiene. Workers who are foreign or migrant often live in dormitory-style residences. So very often the people in this work, they will just go somewhere, work flat out for 6 months, then go home. And why waste money on accommodation when you're just working away from home? So very often they live in very crowded and sleep in dormitory-style accommodation, which could be a factor. They often go to work in crowded cars, vans and buses. And their access to fresh food can be limited due to their shift working. So just wondering if that could be some of the reasons why there are problems in Germany as there was in the United States in this particular sector. So we see increasing cases in quite a few countries. Increasing cases in many countries, really. The World Health Organization is saying that the pandemic is accelerating globally. Why have I gone out of focus? I'm out of focus. Never mind. Something to do with this. I don't know. Something to do with this camera. So the cases globally are increasing. The pandemic is accelerating. Now, good news in many countries where the lockdown measures have worked. But poorer countries, increasing cases, increasing deaths, and these early reports of health services being overwhelmed are particularly concerning because that is going to increase the case fatality rate. Right, let's look at some pictures of you great people. Let's hope you're in focus. Oh, I'm in focus again now. Technical mysteries to me, I'm afraid. Good. So this is Amy and Daryl, who watch in Perth. Now, I've had many pictures from Perth, Australia. And glad to see the vitamin D with Amy, and Daryl is holding the masks, which is great. But no one from Perth, Scotland. Very disappointing, Perth, Scotland. So if you live in Perth, Scotland, do try and send me a picture in, and don't be outdone by Perth, Australia. But anyway, delighted Amy and Daryl are watching. At a guess, this is Alex and Richard, hard to tell, but they are from Canada. So glad you're watching, guys. Keep it up. Glad you're practicing wearing a mask, Richard. I'm sure Alex has got one for when he goes outside as well. Watching My Immune Kit. Okay. Not sure who that's from. Oh, that's from Jihada. I'm not sure where Jihada's watching, but thanks for watching. This is John in Kenya. So good to see you watching in Kenya, John. It's back to front, but I think that's vitamin D3, so excellent. plenty of sunshine in Kenya, but if you're not getting enough sunshine, the vitamin D3 is very good. Good to know you're watching in Kenya. This is Kylie, who watches in Australia, Sydney, I think. Now, I think Kylie was on before, but she's wearing a different mask, so it's quite acceptable given that she's wearing a different mask. But glad to see you're still watching. Obviously a faithful viewer in Australia. This is Marie and family in the UK. So great to see you're watching in the UK. Always nice to see families watching, of course. Watching as a family is excellent. This is mum and daughter in matching masks. Now, I do apologise. I can't remember your name, but I do remember you're watching in Chile. But anyway, good to see mum and daughter watching together. Thank you for sending that in from Chile. Oh, this is your kit, isn't it? Let's have a look at this kit, actually. So we've got some gin. Now, gin is quite good for disinfecting surfaces. Stronger alcohol will be better. 60% alcohol will be better. That's probably just 40%. As long as you don't drink it anyway. So we've got cleaning things, vitamin C. Okay. Yeah, not quite sure why we need red wine, to be quite honest. Looks like cleaning alcohol. Now, this is good. So we've got temperature probes. An inhaler if that's what's been prescribed by your doctor, which is excellent. Temperature probes, oxygen saturation machine. Now we've got quite a lot of paracetamol here. Now, paracetamol in the States, that's the last picture. Paracetamol in the States is called acetaminophen or Tylenol. And what paracetamol and ibuprofen will do is they will lower your body temperature when you have a fever. And that will make you feel a lot better, because when you've got a fever, say 39 degrees centigrade, the acetaminophen or the paracetamol will bring it down to 37 degrees centigrade, and you will feel one heck of a lot better within about half an hour. You'll feel dramatically better. But the temperature that you have just brought down was deliberately induced by the hypothalamus in your brain stem. It was stimulated by cytokines from an immunological cells. Your temperature was raised quite deliberately. It was not an accident. And at higher temperatures, the virus does not reproduce as well. And at higher temperatures, the immune system is working with greater efficiency. So by reducing the immune system, by reducing the temperature, in my view, you are reducing the efficiency of the immune system. And in adults, the temperature won't keep going up and up and up. It won't become 39, 40, 41, 42, then 43. It nearly always gets to a particular level and stops. So keep an eye on it. If it does become too high, treat it, of course. But for most of us, most of the time, if we take paracetamol and ibuprofen or acetaminophen, that's going to bring the temperature down and, in my view, reduce the efficiency of the immune system. So in my view, for adults, you're best to leave the temperature higher. Now, that is not consistent with many guidelines, and you must do what your doctor tells you, but that's my view. Okay, that's us for today. Thank you for watching.